discuss with many people, most of them say the niceties of UK.
Okay.
But I want to be a little different.
Uh-huh.
For my candidates or my nurses who want to pursue their career, can you see experience? What I understand from experience is the failures which we have.
Okay.
Okay.
Yeah.
Now, when I say failures, of course, these are the stepping stones. We correct it,
Yeah.
and then we become a success.
Yeah.
Of course, I know that when you go to UK, there are certain things which we are not supposed to do and which we are supposed to not to do and to do.
Yeah.
Now, I want to know what are the things which we should not do. Okay, when you are in UK as a fresh nurse.
Yeah.
Okay.
Yeah.
Whether because currently everybody says the moment they finish their classes they want to go to UK. We are fine with it.
Yeah.
But what are the difficulties of a fresh nurse faces when they reach UK?
Well, I would say, as a really fresh nurse, I'm thinking about myself when I graduated. You really do not actually know the practical aspect of nursing. You will know only that when you are actually a nurse working on the floor.
Okay.
And then it makes a difference when you go abroad. What they see, what they look at you, how they look at you is that you have experience. And you get that experience only after you work. How much ever you study theory or during your nursing course, that may not be sufficient to work as a proper RN in the UK. So I would say get at least a couple of years of experience before you plan to relocate to the UK.
Okay.
Again, when you come to the UK, that will give you an idea of how things work differently in here and there.
Okay.
So there they follow policies, guidelines in whatever they do. Maybe it's just putting an IV cannula, but they have a policy. And then, they go according to the policy. Here, I don't know, I haven't worked recently, it's been many years, but when I worked, you just go and put a cannula.
Yeah.
Maybe it might have changed, but what I want to say is they follow everything according to a policy and protocol guidelines. Again, there are lots of differences, like cultural differences when you say things there. One of the main things I would stress to people, whoever is going to the UK, is using please and thank you.
Oh, in UK.
In UK.
Okay.
Well, they might ask you, would you like a cup of tea? And then you would think, if you say nicely, oh yes, I would like a cup of tea, but that's not the way you have to say. You have to say, oh yes, please.
Okay, that please word should be there.
That please word should be, otherwise it's considered rude.
Okay.
And then if someone is giving you a cup of tea, you'd say, oh thank you. That thank you and please, even when a patient receives his medicine, when you are giving a medicine to the patient, that's, the patient has the right to get his medicines, but the patient would say, thank you for giving me the medicine. So that's their culture. So there are lots of things like that we wouldn't expect, like saying please and thank you with each sentence.
Yeah.
But that's how you should be. But once you are there, you will know all this, but it's nice to get that knowledge, isn't it?
Before that, yeah.
Yeah, so there are lots of things like that.
So these small things really make life better.
Of course.
Isn't it?
Of course.
I really understand that. And so there are certain things which we should understand and the nurses should understand before going. So what I suggest is, of course, a fresher can go, but they should have a bit of polishing or understand how it is before they reach UK. Now, I think you also suggest the same thing.
Yes.